And good morning, folks. This is Paul Stone. Happy to be here today to bring you the Senior Talk Show. Brought to you each week by Harbor Place, a senior living community located at 3700 Southeast Jennings Road in Port St. Lucie. We're joined today by Diane McDonough, the Director of Sales. And Diane's guest today is Melissa Giarrotano. Is that correct? Okay, good, very good.
Good morning, Diane. Thanks for having me.
Oh, great. I'm glad you're here. Please share with us more about you
Okay.
and your role with Mederi Caretenders.
So I'm a registered nurse with Mederi Caretenders, and my role is I'm a account executive / patient care liaison. I work in between the families, the doctors, and the patients to get them the appropriate care they need at home based on their Medicare benefits.
Great. And tell us more about Mederi Caretenders. How was it created, how long it's been in business, and its mission statement?
Well, our mission is to look beyond the obvious needs of the seniors, meaning that a lot of times we can always tell a patient needs home health care from a recent hospitalization or a fall or an injury or wound, or those things are pretty standard. But what we've looked at is, a patient comes into the office, maybe disheveled, maybe something's going on, and the doctor can't put their finger on what it is. So our nurses will go into the home and look, beyond the obvious need of what the patient actually has going on. Sometimes it's a matter of opening up the cabinets and seeing they're only eating, prepackaged food, which is high in sodium, which will cause high blood pressure, which can then everything rolls down from that. So, and a lot of times if the doctor says, are you eating well, they say yes. They don't realize that what they're eating is high sodium foods that's causing them an illness.
Right.
So,
And with Mederi Caretenders, tell us about the name.
okay, so Mederi is the Latin word for be well. So it's Mederi merged with Caretenders years ago. So there was a Caretenders, there was a Mederi, and now it's Mederi Caretenders. Although in the state of Florida, I believe, and I'm not exactly sure, but I think we're under about 14 to 15 different names. As we merge with the smaller companies, we keep their name to keep that, the same, routine going on. But with Mederi Caretenders, we're all the way up into New York, Connecticut, New Jersey, Massachusetts. We're out to Louisville, Kentucky is where our corporation, our home branch is.
I would think that would create more services offered.
What's good for us, and of course me as an account executive, is that if I have a patient visiting here from Massachusetts, and we actually just used this service with my grandmother who came down with me, and we were able to keep Caretenders here in Florida and then merge her right back up to Massachusetts and roll her care right back into Mederi Caretenders up there.
Fantastic. Well, let's start with the basics. What is home health care?
Well, pretty standard. It's homebound patients is what it used to be, was a homebound patient, meaning didn't leave the home. Medicare is broadened that now. It's a taxing effort to leave the home. So what does that mean? If a patient becomes short of breath with a minimal exertion, it's a taxing effort. If the patient walks out the front door and trips and is unsteady with their gait, it's a taxing effort. Dizziness, there's a lot of different things that can cause you to have a taxing effort to leave your home. And you can still, with home health care, even though, you have those, go to the hairdresser. You can still go to church. Medicare's incorporated those things in, so it allows the patient to still be covered while they need the acute services.
But how long is Medicare able to pay for this?
So that's a good question. So what it is there's Medicare, and then there's your managed care Medicare. And a lot of my patients don't understand the difference between Florida Blue, Humana. They just say, no, I have Medicare, because they still have their red, white, and blue card.
Right.
But what a managed care Medicare program is exactly what it says. It's managing your Medicare benefits for you.
Oh, I see now.
So it really depends on what you have for insurance on what Medicare will allow you. So with traditional Medicare, your government insurance with the secondary or Medicaid secondary, the professional is allowed to make the decision on what you need. So if a registered nurse goes in and evaluates a patient and says the patient needs A, B, and C, we need physical therapy, we need occupational therapy, this patient is having difficulty swallowing, we need speech therapy, we just do it. Because Medicare gives us allotment of money and we just break it up and we just take care of the patient. With your managed care, you are typing in your or calling in your assessment to somebody on the other phone that's never laid eyes really on the patient, and you're saying we need, A, B, and C, and they say, well, we're going to give you A, we're going to think about B, and forget C because that's just way out of, and then they are getting that money from the insurance companies and they're managing it for you, and so that's the difference between that. So we like to work with traditional Medicare because it allows us to give the patient whatever they need.
All right, and I know that you explained some of this, but how are home health care services paid for other than the Medicare part of it?
Well, for your traditional acute care, we'll call it, meaning post-hospitalization, physical therapy, surgical. If you think of anything like, even pneumonia, COPD exacerbations, which is coronary obstruction, pulmonary disease, which we see a lot of now because although we feel smoking is, taboo in our generation, back, say when my grandmother, even my mom was growing up, everybody smoked. It was just the thing to do, and they smoked everywhere. If you smoked 9 times out of 10, you're going to have COPD when you get to your older years. It's almost a definite. Whether it's a mild or severe case, it's going to be there.
How about secondhand smoke? Like my father.
They say
smoking.
say that is
no.
but I don't know if there's any studies about that. But now you get me thinking. Maybe I will look that up. But
Please do so.
so yeah, those will be covered under Medicare. So but and in your managed care patients will still have the benefits as long as they make sure that there's a clause in their thing that they have home health benefits. Because if they don't, then it would have to be paid privately, which is out of pocket.
Okay. Who's entitled to home health care services?
Actually, anybody. It's not even seniors anymore.
Really?
Yeah, anybody really, as long as there's, a lot of the Blue Cross Blue Shield patients, we do get those younger going through, some stuff. Medicaid patients are entitled to it. Yeah, anybody can get home health at this. I mean, never used to really be that way, but now it's open to anybody under the direction of a physician. We just can't see the difference between Medicare home health and your private home health is that private, anybody can just get because they're paying, it's like a consumer. They're paying for it.
So you just said if you are under Medicaid.
Medicare, Medicaid would be covered for home health services.
Great. I didn't know that.
Yeah. Medicaid's a little tough, especially in our area, to find a provider that takes it. I usually will dig deep enough, we'll find somebody. But it can be a little bit tougher. There are 1 or 2 in this area that will. But those are usually our younger patients that are struggling with a pretty serious, significant disease. And they usually have a case manager looking over them that's helping them.
Fantastic. What does it mean to be homebound?
So homebound is a considerable and taxing effort to leave the home. So anything that you can go shopping, but if you get home and you have to take a 2-hour nap because you're so exhausted and wiped out from that, then that's a considerable and taxing effort to leave the home. Pain levels, you go out, but you're in a lot of pain.
Okay. And if I wanted to start the process, how do I contact you? What am I going to expect?
Okay.
What do you need from me?
Okay, so really all I need is your physician's name. I need your name and your date of birth and your physician's name, because from there the physician's office and myself will take care of it. And why you're seeking it out, what's going on that you feel you need some help at home.
Okay. And then tell me a number and how I can contact you.
Sure. You can reach me directly on my mobile phone, which is 772-579-0922, or you can always call our office at 772-879-2224.
Can you explain the initial assessment?
Sure. It's a little more lengthy than your visits will be. The initial assessment, the nurse is going to try to get all the information that she can. There was a time I was working with people in, communities like beautiful Harbor Place and other communities to try to get a almost like a little USB or something just to have all their health history written down. Because when you're looking at our patients now, we have people living 80, 90. My grandmother just passed away 2 weeks ago at 103. So, I mean, they live lengthy life. So, do you remember what happened to you when you were 70? That's like 30 years ago. Like for me, I don't know what I did 30 years ago, and I'm not even that old. So we really want people to know their history because, like for me, my father had a massive heart attack at 52. So now he's 70 in his 70s. We just had this conversation yesterday with him. He doesn't even know to tell doctors that happened. It's very significant to have coronary artery disease at that young of age. And it's important for me to tell my doctor that my father, So it's important to know your health history. So I always try to get a timeline from people. Let's talk about, when was the first time you were ever hospitalized? Oh, yeah, when I was, 50, I had pneumonia and I had to go in. Well, that's pretty important.
Have you ever done an assessment and you realize your services would not be able to take care of their needs?
Absolutely, yeah, a lot of times.
Can you give us an example?
Sure. Actually, it's one that we were talking about not too long ago. It was a patient who lives independently, goes out, probably every day doing what they have to do, but for some reason isn't taking their medications properly. So, could we go in and, but find out why? Well, we questioned the family, and they said, no, he's fine. He's alert and oriented. Everything's great, but he just doesn't take his medications. Well, what do? We put him in a pill box. You do. Okay. So it's all set up. Yeah. What does he do? He throws them on the kitchen counter. Mm. Okay. Well, in that case, I don't think there's too much we're going to do for him because my question to them is, maybe you need to find out the root of why he does that. Maybe he doesn't want to take his meds. Maybe he's confused, But for us to go in there in a case like that, I think we would cause more agitation for him than anything because that's all we would be focused on is why are you throwing your pills on the counter? And he may get upset with that. And so what we do in those cases is refer them to somebody bigger like the Alzheimer's community care where they can send a nurse out to do an assessment based on mental health issues.
Oh, that's good advice. And then from there, maybe there's a community that would be able to assist them.
Maybe there we can find out he's just stubborn and he doesn't want to take them, or we can find out that there's an underlying issue.
Correct. Who actually provides the service in my home if they came to my home?
So it would be, we have a team of registered nurses. The majority of our nursing visits are done by RNs. We do have 2 LPNs. But the majority, and they just, what they do is they work under the direction of the RN. So the RN will always start your case. You'll never have anybody but an RN come to the house. And then they do that complete assessment, that 25-page oasis for Medicare. And then from there, we will make the plan. Physical therapy, occupational therapy, home health aid, whatever you need while we're in taking care of the patient.
What's some of the questions on that assessment? What did you say, 25 questions? Just
25
a few.
25 pages.
25 pages?
Yeah. So we go into functional ability. Do you stand and dress yourself? Do you need assistance with dressing yourself? Do you need assistance with walking? Do you use a device? Do you eat independently? Do you make your own food or do you just feed yourself? Or do you do both? They break it down. Memory. Do you remember your medications or do you need to go by a list? Do you remember, your doctor's appointments or, it just breaks it all down. Do you drive? Do you not drive? Are you incontinent? Are you incontinent? You know what I mean? Are you continent? Are you, everything from head to the tip of your toe, they ask you. Skin assessments.
And then you have to determine from that assessment what is the good plan of care, but also through the doctor that helps as well, right?
Right.
You take that combination of both to come up with a care plan.
So our nurse puts the care plan together and then reviews it with the physician. The physician signs it, and then we head out.
Okay. Well,
Typically, it's a good 6 to 8 weeks, sometimes longer.
Well, you did answer one of my questions that health agency provides a nurse and the therapist. And will you have a different nurse every time they come?
No. For continuity of care, the majority of our cases are started by the nurse that starts the case is what we call a case manager. And that case manager reports to a clinical manager, and the clinical manager reports to a director of nurses who reports to so that, you got a whole team involved with your care, and then the physician. So, we have a lot of orthopedic patients because one of our medical director for our company is one of the larger orthopedic doctors that's in St. Lucie County. And so we get a lot of orthopedic cases. And, the majority of their care goes quickly. They get out of the hospital, they get some physical therapy, the nurse watches the incision, everything goes well. But being the age group that usually gets this, we look at comorbidities, meaning multiple things going on. So sometimes they develop some high blood pressure, other things will happen. And then we divert from the ortho over to the primary care physician because, it's just the appropriate thing. So we work with the whole team of doctors that's involved with the one patient also.
Okay, so but is it the same nurse going in at this? Yep. And she's dealing and communicating with all these other physicians.
Yes, ma'am. Yeah, and she's dealing with the physical therapist that's visiting the house who usually, are there times that the physical therapist goes on vacation or the nurse gets sick? Sure. And then we would alternate. But you don't have a different nurse every time that comes into the home.
You want to build that trust.
Yeah, and continuity.
Right. And that trust is built from that continuity, like you just mentioned.
Right.
Yes. And I think the family feels better, especially if the family is not in the area.
True.
That same nurse they can communicate with. Am I correct?
Absolutely.
Will that nurse communicate with the families?
Oh, absolutely. As long as they have permission. We can't speak to anybody unless there's permission with, I've had a case recently where the son just couldn't understand why I couldn't, speak to him. And, I said, if you get mom to say yes, I will.
Those are HIPAA laws, right?
Yeah, we have to protect the patient. They have rights.
Okay.
And that's one of the rights is to choose the home health company of choice. We have a lot of doctors that will sometimes, I like this company, use this company. Well, that's great. And we respect your commitment to that home health company because I love a doctor that says that about me. But at the end of the day, it's the patient's right. If they don't want to use that company and they feel comfortable somewhere else, it's their choice.
All right. How does Mederi Caretenders maintain quality care?
Well, we all home health companies are under under the ACA. And if
Tell us what ACA stands for. People in our industry knows what ACA is.
Let me look that one up. Yeah,
but,
it's
that's okay.
No, I do know because we just talked about it the other day. We try not to talk about ACA in home health because it's not one of our. It's the American. No, that's not it. Hold on.
Accredited health?
Yeah. It's actually what we all have to report to in order to, all our stars, they call them. And as
I think
simple
it's
as
accredited healthcare agency.
It's coming up.
Yes.
But you remember in like third grade when we got stars and you got your name up on the board and you got 1 star, 2 stars. Well, that's how we're rated. That's how home health companies, believe it or not, Agency for Healthcare Administration.
Oh, okay.
Agency for Healthcare Administration. So, and probably some other people, they could have rattled that off the top of their head. But like I said, we stay away from that. Yeah, we say ACA because we try to stay away from them. Because really the only time they pop into your life is when there's an issue or a yearly survey, which is fine. I mean, we fly through those with no problems with Mederi because we're not a gray area type home health company. It's black or it's white, and that's it. We go by the regulations of Medicare, and there's no deviation. And I have
There's heavy penalties for that.
Heavy penalties.
Yeah, I know.
But some companies don't mind paying that. Like they'll do something a little bit different. Just $5,000 is a drop in the bucket to get 10 referrals. Not for the integrity of Mederi. Our owner, Mr. Yarmouth, is still very involved with the company. He started it way back in the 70s. So he's very involved. And I remember when I first started, he said, do right by the patient, you'll never go wrong. You'll never have trouble. And that's his philosophy for this entire company that's now ginormous. And I think that's the reason it's so big.
And let's go back to your maintaining quality care.
Yep.
Even though it's through ACA, we know you're governed by them.
Yes. So basically, we are watched. It's the consumer will get a form, and they'll say, how did you do? That's simple. And then, of course, when we admit a patient, we do that 25-page assessment. When we discharge, we do the same assessment, similar, smaller, but similar. And so it's asking those questions, do you walk with assistance? Well, yes, I did. No, I didn't when I started, but I do now. That shows improvement. So, no, I did when I first started, but now I don't. Well, that shows a decline. So that's how we're scored.
All right. And how can we use Mederi Caretenders home health to prevent unplanned hospitalization or re-hospitalization? And if you can explain those two as well.
Sure.
Oh, looks like we got a few minutes here, but if you can explain that,
Okay.
then we'll continue on
Sure. So
the next half hour.
what we like, it used to be, home health used to be one of when a patient went in the hospital, they'd come home with home health. And it was pretty traditional, and the doctors were accustomed to that, and that's kind of how it worked. Well, now what we try to do is get to the patient before they get in the hospital. So if they're diagnosed with diabetes, high blood pressure, we ask the doctor, let a nurse get in now when they first got diagnosed and they first start their medicine so we can educate them. Maybe avoid going to the hospital because when they hear the diagnosis, anxiety kicks in immediately. And so then they start trying to look up WebMD and they're looking up,
That's true. I've done it. I'm guilty.
Yep. So then they've got themselves clinically dead because they've already looked at all these things that could happen to them that most likely won't if we intervene early enough. So, so that is how we can avoid the hospitalization. The rehospitalization part is very key with Medicare right now. And do we have time to talk about that? Because
let's go ahead and wrap it up now. And
Sure.
So this morning we've been listening to Harbor Place bring you Senior Talk. Our guest this morning is Melissa Giarrotano with Mederi
Caretenders.
Why do I want to say something else, Diane? I don't know.
A lot of people want to say caretakers.
Okay.
Or caregivers.
Very good.
So it's caretenders.
We'll be back in a few minutes. We're going to break away for Florida News Network. This is WPSL, Port St. Lucie. And welcome once again to Senior Talk, brought to you every Monday morning at this time by Harbor Place, a senior living community located at 3700 Southeast Jennings Road in Port St. Lucie. Today we're joined by Diane McDonough, as always, our Director of Sales. And Diane is joined by Melissa Giarrotano. She's an account executive and an RN with Mederi Caretenders of Port St. Lucie. Good morning again, ladies. Let me get your microphones on here. Now we're ready to go.
Great. Thanks, Paul. First of all, I wanted to invite all our listeners to the Harbor Place Open House. We're going to have food, fun, and fabulous entertainment. It is this Thursday, March the 9th, from 4 to 6 p.m., so it's anyone in the public can come in and really learn about us. I know you listen to our show once a week, but come in and learn more about independent assisted living. And, of course, we have our sister community life care on site with the skilled nursing and rehab. Our number is 337-4330 if you wanted to attend and just RSVP and bring a friend. It'll be a lot of fun. Melissa, we're back on the show again. Thank you for coming today. If you can tell us your contact and how to reach you and your telephone numbers.
Sure. It's Mederi Caretenders, and my mobile phone is 772-579-0922. And Mederi Caretenders, our office number is 772-879-2224.
Fantastic. If we can just go back, I just wanted to have ending conversation on that unplanned hospitalization, how you prevent it or re-hospitalization.
Right.
And why is that important?
So we talked a little bit about the hospitalization, which sometimes it happens, and we know that you're going to get care after that. The re-hospitalizations means when you've been in the hospital and you go home. A lot of times with our seniors don't really realize that when you go home, the medications that you were on previously are not the same ones you're going home on. So a lot of times that's our reoccurrent emergency room visits is, over-medicating because they've taken what they've taken already, but then they've taken the new medications and now they've bottomed out their blood pressure or, their heart rate or something to that effect. So it's very, very, very important for us to get in there within 24 hours. We make a phone call almost immediately when they get home. You're home, good. Did you get your medications? No, you didn't? Okay, well, let's talk about that. Were they called in or do you have the scripts? Well, I have the scripts. Do you have somebody to go? There's a whole process here. Do you have somebody to go fill it? Yeah, my son's going. Okay, well, can I speak with him? Because is that okay with you? Because he needs to go now in case you have to take something tonight. And we usually have the hospital paperwork, so we know what they're taking and not taking. And if it's only a morning pill, he can go anytime that night. We work with some private duty companies sometimes for patients that come home and don't have anybody in the area, because they'll put an aide in for 4 or 5 hours that evening and actually say, I'm going to go get the meds for you, and I'm going to make sure that your fridge has that old milk that's been in there for 3 weeks out of there, and we're going to get you some fresh stuff for the morning. And so it's a little transition. And it's a nominal fee for somebody that lives. If you have a son that's up in Connecticut or California or wherever they are, it's a nominal fee to know the safety of their parent or their aunt or uncle. So that will help that way. But we really try, because Medicare has keyed in on certain diagnosis. If this patient goes back into the hospital within 30 days, hospital won't be reimbursed.
Are you kidding?
Mm-hmm. COPD, an MI, which is a heart attack, CHF.
Why? What could have gone right? I mean, I know you explained some of the things, but is it mostly because of medications?
It is 80% is medication error, but sometimes it's unavoidable. If they had a heart attack and they come home and they're having chest pain again, I'm not too concerned with what Medicare is going to pay for, what they're going back.
But if I'm rehospitalization for me, and I still can get Medicare to pay for me if I originally went in with Medicare.
Not for the same diagnosis, not for just for that group of diagnosis.
Okay.
Yeah, they won't. Basically, I think what Medicare's trying to say, and I don't think they're trying to say, oh, hospitals, we don't want to pay you because, we don't want, those are high diagnosis. I think what they're trying to say is get it right the first time. Don't send them home if they're not ready. I think that's kind of what Medicare looked at it. A lot of times they get them in, they get them right out. And that's not really the case anymore.
Who pays for that? Who pays for that second visit then?
In
other words, you're going back in again.
Yeah.
All covered by insurance, or to the hospital? They start
for those key diagnosis. Nope, they have to eat it.
The hospital.
That's what I was trying to say.
That's
really?
appropriate. Sure.
Yeah.
Well, they made the mistake of they shouldn't have sent him home earlier. Apparently.
Right.
Melissa, how long have you been with Caretenders?
So I started back in 2007. I was there till 2012, and then I left and did some home infusions for cancer patients and that kind of stuff for about 2 years, and then I went back to Mederi.
What is your personal background, education-wise?
So I started out my LPN. I actually started out as a home health aide. I was a home health aide when I was 18, and then from home health aide I went into an LPN, a licensed practical nurse, and then from my LPN I went to my RN. From my RN I just completed my bachelor's degree in nursing.
Excellent.
Congratulations.
Very good.
Thank you. So yeah.
You're very knowledgeable.
Me and my 7 kids. We found time in there to get schooling done. So.
Yeah, I know you didn't mean 7 kids.
Yeah, I have 4 and 3 stepchildren. Yes,
Good
we have
for
7,
you.
and I have 3 grandbabies.
Okay, let's talk about our pets real quick. So it's almost like if you need someone to adopt a pet, you can call Melissa.
No, if my husband's listening, she didn't say that. She didn't mean it.
Well, tell us about the pets and how you were able to receive those pets.
Most of my animals come from previous patients that cannot take care of them. My Peaches, who I love dearly, who passed away on me, was 17 when she passed away as a Pomeranian, but I got her when she was 2. It was a patient that had COPD and he couldn't breathe. And, she used to jump on my lap every visit. So I said, all right, put her on my arm, and I said, we're leaving. So that was my Peaches. But, yeah, I tend to get animals. But I find them homes usually. We don't keep them forever.
Well, that makes you a very special person. Well, we're going to get back.
Did you hear that, honey?
Well, in reference to home health care, does home health care have to be prescribed by a doctor? Does it have to be? It has to be.
It has to be, yes. It does, because if not, I would be having an MD after my name, not RN, because I'd be going in there and taking care of a patient myself, and I can't do that. So I need to work in the direction of a physician.
What is home health aide?
So a home health aide is somebody that assists with bathing, dressing, making the bed, maybe putting the dishes in the dishwasher. They come in, and Medicare will cover that for a short time.
Why a short time? What is a short time?
Home health in general is an acute fix to a big problem, if that makes sense. So we're in there really just to make sure everybody's taken care of, they understand their disease process, their medications are proper, they're stable, and then we pull out. So while we're in there, we can provide a home health aide to help with those services. But once we pull out the home health aide, so if you think of it this way, the home health aide works under the nurse. the physical therapy, they all work as a team, but you have to have a discipline in there for a reason. We just can't go in there and say we're going to stay forever, because Medicare wouldn't like that very much.
Okay. So how often will home health care visit, and how long will the services last? You kind of explained that a little bit more. Did you want to?
It's just really in the plan of care. So we have patients that we get into that we could see once a week, but therapy is going to be the driving force. So they're going to be in there 3 or 4 times a week.
So let's talk about the therapy. Are you talking about physical,
Yes,
occupational,
both.
or speech?
All. So it depends on what the diagnosis is. So if we've got a total knee, total shoulder, hip, PT is going to be the driving force, not so much the nurse. The nurse is going to be there to help with the pain management, make sure they go in the bathroom okay, because pain pills will cause that issue, and the incision is good and all that kind of great stuff. But the therapy is really going to be driving the case. And with a stroke, could be speech that's going to be driving the case. It's funny with a stroke patient, although they have lots of different ailments, it's their voice that tends to be the thing that will drive them more crazy than being able to stand up and walk to the kitchen. It's not being able to speak.
To communicate. To communicate.
Yeah. So that's usually the driving factor in some of our neurological patients, even Parkinson's.
Should I hire a private caregiver or a health care company?
We work together with them. So there's a difference. A lot of talk has come up lately about the difference between a registry versus an agency. Traditionally in this area, we've used a lot of registries, which is really you just using the home private care company as a sounding board to find you an aide. So they find you an aide, but there's a self-contractor, and that they have their own insurance, and they're kind of basically, self-employed. And then there's an agency who the people actually work for the company. So they're responsible more than...
And you are
We are just a Medicare certified. Almost Family, which is a sister to my company, is an agency. It's their own employees. We don't do the subcontracting. There are employees that we are responsible for.
So I want our listeners to understand that, because it is confusing. I understand that. There are home health care companies out there, but the difference is, are they an agency or a registry?
Or Medicare certified. See,
there
is private duty companies that will call themselves like ABC Home Health Care.
Mm-hmm.
And people will think, oh, I use them, but they're private duty. They're not Medicare certified. So, when I went through this whole healthcare navigation with my grandmother recently, we were up in Massachusetts. Love Massachusetts. I was from there. But the way they treated her at 103 was so much different than the way we do it down here in Florida. She's 103. What do you expect? She's 103. I looked at her and I said, Nana, you want to come to Florida? She immediately, yes. She got on the plane with me, just status post congestive heart failure, and we came to Florida. She developed another exacerbation while we were here. I used House Calls Express. They came into the house because she didn't have a primary doctor here, and we did the best we could as far as what we could do at home, but she really needed to go. My husband and I went to the emergency room at St. Lucie Medical Center. Age was not even a factor the way they treated her. They took her in, and they just did like they would do with any other congestive heart person. And they pulled her out of this exacerbation. And I really thought that was the end that night. When I left, I thought I was going to get the phone call that I needed to get back there quick. But I went back there the next morning, and there's Nana in the ICU sitting straight up saying, get me out of here. I'm ready to go home. What they did with her was just nothing. It was amazing, and I knew the doctors, which was, better, but they said, you tell me what you want. Because, yeah, she is 103, but what does she want? They were more valued on what she wants. So it was really a great tribute, I think, to what we do down here in Florida as senior advocates.
And you did explain a little bit, but how do I choose a home health care provider?
So, again, you can go online, but just remember, those are assessments that are not always completed by the nurse that start. We're finding that the people that are getting these high scores, I'm like, how are they doing that if they have such a huge, you can change the answers here and there. And so what I always say is ask for a referral from somebody. Go to somebody you trust in the healthcare world and say, in your physician, physicians, sometimes they don't want to get involved with it and they don't know, but get out to every education. Harbor Place has some of the best, educational classes there. And normally they're run, I've done several, they're run by people that work in this community and will know. Right. And that's what you want to do. You want to ask around. And but if you're looking for the outcomes and to go that route, go right online. And they can tell you, go to Home Health Care Compare.
Mike Fowler, am I correct? From
and
Elderly
yes.
Law.
Oh, yeah.
He sent me something. I'm going to give you a copy about it. But there are some Medicare changes on how they do assessments.
Yeah.
And you're right. I'd rather have a registered nurse coming and do an assessment with
Lots
me.
of changes coming through for home health care coming up. And then again, now we have a new president, so we don't know if they're going to change again. So the Affordable Health Care Act really gave us a run for our money for home health. And so we're going to see what some of the changes are.
Is there any place where you've mentioned a few things here that, quite frankly, have been way over my head, but as an elderly person out there listening to the program today, how in the world can I access all of these things you've been talking about? Is there one location to go, or to ask your son or daughter to go online and find out where I can find all this information out with one easy step?
Yeah, I wish it was. And and actually, that's what I was talking about with my grandmother. I know the system and I can navigate through it. I sympathize with people that don't have an advocate for them. Your Council on Agings are a great resource for that question alone. I know Mary Craig at St. Lucie Council on Aging and that group, they'll direct you to anywhere you need to go. And we work with Laura Zell from Morse Life, who's a caregiver advocate. But yeah, you really ask, and you start with your physician, because some of the physicians now are getting in tune to that as a resource. I know I have a couple of physicians that use me as a resource guide. I'm not necessarily getting that patient as a patient for me, but I'm getting it to talk about, well, I need this, my loved one needs this. I know I don't need home health right now, but what do I do?
Well, Florida certainly has to have one of the largest senior populations in the country, I'm guessing.
Betcha.
If not number one, close to top 5 for sure.
Not even elderly, though, even younger. I even said going through everything, if I get sick, I feel very comfortable about being taken care of here versus up north. And usually you get the opposite from your snowbirds. I need to get back up north. My doctor's up there.
Yeah.
And let me tell you, don't go rushing back, because it's not that, we have wonderful physicians in this area and a lot of them are younger and they just got out of school and they're like, yeah, I got this, and some of them are older and they still value their patient.
That's great. Good to hear.
So Melissa, it's my understanding it's just not going to the home that you can use home health care.
Right.
You refer people to us.
To assisted living.
Right. And then we can use you in our independent assisted. Explain how that works.
Yeah. So we have skilled nursing facilities, assisted livings, independent livings. We can't see patients in a skilled nursing facility, but when they get out, we can. But a lot of times we go into the home and we realize, you know what? You've been in the hospital 3 times in the last 6 months, and this house is not really kept up the way you used to do it. You really need to look at an assisted living. And I try, and I almost beg my patients, go now. Go now when you have your faculties and you can make your own decision. Doesn't mean you're moving in tomorrow, maybe a year, but go see Diane at Harbor Place and say, you know what, can I look? Can you talk to me a little bit about what the process is? What if I have to sell my house? What if I have to do this? And they're going to walk them through it, but it's going to be done. So you're not going to be in an emergency state making a decision you don't want to make.
Well, let's talk about some senior health concerns, just a highlight on it. High blood pressure.
Yep. Well, we were talking about the obvious needs of the seniors. A lot of times we get a patient with high blood pressure and they're trying this med and that med, and none of these meds are working. And finally the doctor's like, can you just go out and see what's going on in that house? I don't know, sometimes it's stress. A lot of times we see our younger, and I'm 45-ish. And so we see the younger people coming back home. And that causes stress for me, I have my kids back at home, but I live in a generation where that's kind of like, that's the way we are now. But my mother, if I was to move back home, she would be like, whoa, wait a minute. You're interrupting my daily schedule, and that can cause stress. Something as simple as that, or the foods. Our seniors will use frozen foods. So high in sodium. But if they're doing that every day, they're jacking their blood pressure up. And it's something as simple as that we can fix.
Nowadays, too, blood pressure, if you're over 140, you need pills.
Yeah.
It seems like. Years ago, 140 was no problem.
See,
Now,
I'm not a pill type nerd. Like, do you need pills? Nah. Can you change your exercise
Diet?
and your diet and drop it yourself? You can. If you know,
want to.
If you want to. And that's what we run into. Nobody wants
A lot
to.
of
What's
folks
fun?
prefer that pill over running a mile a day, you
Isn't
know?
that nuts? Isn't that crazy? Because that pill is going to bring you so much more problems in the end, you know? And it's, I have diabetics that I've gone in, we've done educations on that have been on insulin that have come off.
Really? Fantastic.
Yeah. My mother-in-law was one of them. She had an diabetic educator, and she came off her insulin.
So what can you do for those with diabetes?
Sure, yeah. Diabetes is we know so much more now than ever. It used to be when you got put on insulin, that was it. Not anymore.
Diet is so important.
It's so key. And it's even for your autoimmune, your diet, you know, we ingest so much flour and sugar. And think about it, we do a lot more processed foods and all that kind of stuff now. That's why we see more of those autoimmune problems than ever. So, you know, my son will tease me. My 26-year-old will say to me sometimes, oh, just slice up some cucumbers and throw it in some water for mom and dinner's done, you know? And, you know, no, that's not the truth, but I'm very cautious on what we ingest. And because I know when I go away for a weekend and I eat crap, really, I mean, it's not good. I feel that way on Monday, you know? I mean, I do. I feel like I just ate sugar and flour and all that stuff. But when I go 2 or 3 weeks with none of that stuff, I could run a marathon, you know, and it's just.
Well, Arthritis Awareness Week is coming up, March 23rd to 29th. Melissa, what's your insight on arthritis?
Well, again, diet, exercise. A lot of times we get older and, oh, my knee hurts, it's arthritis. Really, is that your own diagnosis, or did the doctor tell you that? You know, because a lot of times we just assume that's there. And sometimes it could be something a little more serious, or sometimes it's not even. It's just a little bit extra weight on you. And so you drop a few pounds and all of a sudden, look at that, my arthritis has been cured, you know. But there's different types of arthritis, you know, there's juvenile, there's, you know, adult there's all different types. So again, you know, what we know now in today's society, we should not be ingesting all the stuff that we ingest.
Very good. All right, Paul, we have a nurse in the house.
Yeah,
do you have any questions for
our
nurse?
Yeah, well,
how are you
so
feeling?
I feel wonderful. Listen, you know, being brought up by a family who did a lot of, my grandparents were Italian, so we ate everything in their house. I mean, literally the pasta. Back in those days, you didn't have, what's the problem now? People can't eat certain kinds of gluten.
And God forbid you didn't clean your plate when you were eating, because your grandfather would come up behind you and finish it for you before everybody's getting in trouble.
You take what you want, eat what you take, right? That was the old deal back then for sure. Now, you know, gluten and things like words that we know today we did not know 30 or 40 years ago. Not even close. Not even close.
But I don't think there was all those chemicals in the food as they are
Probably
now.
true. You know, years ago, the things we ate came within 10 miles of our house.
And that's
everything
that's
we ate
it.
was
You just
grown
hit
around
it.
your home.
It wasn't McDonald's. It wasn't Moe's.
No,
it wasn't.
Right. We're eating apples coming from across the ocean and oranges from China. My God, who knows what we're eating anymore? So you got to be very careful.
Home cooked meals was. I mean, we were very rarely. My son said to me the other day, "Mom, do you ever cook anymore?" You know, he's like, I need a home cook, and I'm like, well, I did when you were younger, but now I'm busy. So you know, you're 19. They have a great thing on the internet. You can actually plug in what's in your cabinet, and they will come up with a recipe for you.
Really?
Have at it, Stevie. You got it.
Well, Diane, you got about 3 minutes to go. Why don't you finish up, and we're having an excellent show, folks.
Yes.
A very good show.
Melissa, can you tell us your contact information again?
Sure.
And anything that we haven't covered? I know we covered a lot, but anything else you want to share with our listeners today?
Well, surely call my cell phone with any questions that you have, whether you're a senior or not, and whether you're taking care of an elderly mom, dad, uncle, aunt. We see a lot of extended families now. Call me with just any question. I can walk you through it. And if I can't help you, I will certainly find out who can. 772-579 0922, and that's my mobile phone that is on my hip 24/7.
Fantastic. And again, thank you for being on the show. You've been on our show before. You've given a seminar and it was about diabetes at Harbor Place. And we're looking forward to having you come back this year. Just listen to the radio show, and I'll update you when she will be back on the show. But I just want to let you know we do have a stroke rehab and recovery a seminar that's coming up. It's on the 7th of this month, tomorrow, Tuesday, March 7th at 2 p.m. And Life Care will be presenting the physical therapy, and we hope you can come. Call 337-4330. But our big event for the week, again, is our Harbor Place open house.
That's
Food,
exciting.
fun, and fabulous entertainment. Melissa, you coming?
Oh, sure.
All right, so if you want to meet Melissa and you have some questions, she'll be there, and I'll introduce you. It is on Thursday, March the 9th, from 4 to 6 p.m.
Gorgeous building. You need to come out and check it out.
You can call 337-4330 to RSVP and bring a friend. We would love to have you come over and learn more about our independent, our assisted living, and of course our sister community Life Care with the rehab and skilled nursing. Again, we do use Melissa at Harbor Place. I recommend you do use her. She's very reliable, and her integrity is outstanding.
I enjoyed the show very much this morning. Melissa, one more time, please. We've got about a half a minute to go. Give us your phone number and all the pertinent information. One more
It's okay. So it's Melissa Giarrotano, registered nurse with Mederi Caretenders, and it's 772-579-0922, and our office number is 772-879-2224.
Okay, well, very good. Thank you very much, ladies. We'll be... It's about a minute now before the top of the hour. We'll be bringing you CBS News at that time. And another great show, Diane. Next week, we're looking forward to hearing from you again. Bring along another great guest with you. Melissa was wonderful this morning. And next week, we may be Skyping after all. Possibly,
yes, we're going to try to do it right on site from Harbor Place.
We've had Diane in the studio now for several weeks, and we've enjoyed her company very, very much.